23 on the clock here on KOCO 5 News at 9, and with Jane Nelson from the Healthcare Coverage Coalition. We're talking about this bill that's making its way through the Oklahoma Senate right now that would...
Actually, it's in the House.
The House, rather, but it's a Senate bill. Thank you for correcting me on that one. That would basically allow out-of-state insurers to sell here in Oklahoma and allow Oklahoma insurance to be sold out-of-state. Supporters of it say it would drive down the costs. Opponents say, though, it could potentially gut your insurance in some ways in terms of what's covered. So I want to jump into one of the aspects of this coverage that's really got a lot of attention, and that would be autism coverage. Just a couple years ago, the legislature came together in a bipartisan way and added autism coverage as part of those mandates that's required to be covered there in state insurance. And basically we're hearing that a lot of people think this would be one of the first things taken out of most people's policies should this bill pass.
Well, I don't know what out-of-state insurance companies would take out, but I would tell you that there's more than just autism here at stake. We're talking about coverage for cancer, screenings such as colorectal, mammograms, coverage for newborn babies, a number of different kinds of things that are all included. So it's bigger than just autism, although that group is very much a part of the Healthcare Coalition. Our coalition is made up of provider groups and advocacy organizations such as the Oklahoma Nurses Association, the Academy of Family Physicians, Leading Age Oklahoma, Alzheimer's Association, Procure, and autism groups.
So what I hear in there is a lot of the providers of people's health care against this. What is the sentiment you get from providers?
Well, we've all worked together in the past with the citizens of Oklahoma to enact these patient protection benefits. And so we're concerned that our patients would not have coverage for those things that they're diagnosed with or disease states that they currently have.
And a lot of people sitting at home right now, though, if they have this coverage under the Obamacare plan here, they saw their premiums rise 76%. There's just one insurer right now, and the Insurance Commission saying there was the possibility, at least a couple years down the line, there may be 0 insurers for the Obamacare plan. So what then would be the solution if not to allow to sell across state lines?
Well, I think that if you look at this language, Section 4 of the language actually affects that one provider of the ACA or Obamacare plans, Blue Cross Blue Shield, and would allow, they operate as part of a larger group called the Healthcare Coverage, Healthcare. I forget
it's okay,
what.
But just, yeah, we'll move on to it.
Anyway, it is a coalition of states that include Texas, Oklahoma, Montana, New Mexico, and Illinois. And so Blue Cross Blue Shield could bring in any one of those plans from another state and sell it here and adopt
without
that.
all the state coverage management. But the question is cost.
Well, and they wouldn't have to go through they would not have to be approved through the compact, and they wouldn't have to be approved by the legislature.
But what supporters here are saying is that we're at the point where people can not even afford to buy the insurance currently, so they're looking to find any solutions here to bring down costs. You guys are simply saying, no, this won't work. So I'm asking, what do you say instead? What should people be doing to drive down costs?
Well, I don't think we have a lot of answers at this point of what we could do. We need to look at other solutions. I think it's really interesting that the Health Commission or the Insurance Commissioner is very interested, is willing to give away his power over regulating insurance companies, because that's what this will do. Those insurance companies that will sell across state lines won't be regulated by the Oklahoma Insurance Commissioner.
Okay, so we know that there is a hearing tomorrow on this. Jane Nelson, appreciate your perspective on it. Thanks so much.
You're welcome.